Ranking Member Marshall, members of the Help Committee, thank you for this opportunity to discuss the transformative power of the FreshRx Oklahoma program. My name is Erin Martin. I'm a gerontologist, the director of FreshRx Oklahoma, the co-lead of Oklahoma's Food is Medicine Policy Coalition, and a proud member of the National Produce Prescription Collaborative. I started working in long-term care when I was 15 years old. Since then, I have worked in all levels of long-term care, including HUD housing for 62 and older, where I saw people on 15 to 32 prescription drugs per year. During that time, I attended the first and leading school of gerontology in the world at the University of Southern California. And in Italy with USC, I studied death and dying and began to study the blue zones, where people die of something called old age on 0 prescription drugs. I started to understand deeply the connection of food and health. When the pandemic hit, a physician from North Tulsa shared that his diabetic patients were compliant in their medications and their doctor's visits, but that their health was still declining. To try to address this, we co-founded FreshRx Oklahoma, a produce prescription program that launched in North Tulsa, a community with an 8.5-year, sometimes longer lifespan difference from South Tulsans, a community without a grocery store for 14 years, and a community with the highest mortality rates of diabetes in our county. Our program empowers individuals with type 2 diabetes by providing them with biweekly, locally grown produce for 12 months, along with 4 to 6 cooking and nutrition classes per month, and quarterly health metric checkpoints. Participants, or members as we call them, are either self-referred or referred from healthcare professionals at one of our 22 partnering primary care clinics. This also includes federally qualified health centers, PACE clinics, and clinics even serving the uninsured. Provider partners utilize a prescription form to refer the patient and verify their diagnosis. From there, we enroll the member, and they begin the program at the very next food distribution cycle, where they receive a starter kit complete with cooking utensils, cookbooks, and more. This program has significantly shown success in reducing A1C levels and weight, enhancing both quality of life and reducing medical costs. With our first 300 patients, 80% have shown a reduction in their A1C level with an average reduction of 2.2 points. Our largest reduction we've seen went from a 13.6 to a 5.4 in less than 6 months. And our record weight loss was just hit at 116 pounds, fully reversing her type 2 diabetes and coming off of all of her medications. Many of our members report having had diabetes for over a decade, but experiencing improvements in just a matter of weeks in our program. I'm extremely proud of what FreshRx has accomplished, but I'm also proud of my colleagues across the country who are leading other successful produce prescription efforts. There's many ways to provide these services, including prepaid debit cards that can be used in retail, farmers market vouchers, and even online shopping models that work well for different communities. Programs must reflect the communities for which they serve, providing food that is culturally relevant and supporting dignity of choice. Our specific model supports local agriculture, stimulates local economies, and most importantly, transforms lives through improved health. I'm pleased to share that since its beginning, FreshRx has expanded into beyond North Tulsa to 5 rural cities with the Muskogee Creek Nation to serve their diabetic and pre-diabetic populations. Implementing food as medicine is a smart economic decision with an enormous return on investment. Our program's success is a testament to the power of integrating a food as medicine approach with our healthcare framework and providing a regenerative, cost-effective solution to our nation's health crisis. The Senate Help Committee has an opportunity to integrate produce prescriptions across federal health programs. Doing so offers a promising pathway to not only manage and prevent chronic disease, but to save on healthcare spending and resurrect local economies. Again, thank you for considering the potential of food as medicine. I'm eager to answer any questions and discuss how we can expand these vital services to enhance health outcomes across our country.